Hello everybody, Dr. Daryl Boston with Barrie Chiropractic and Health Services Center. Today we're sitting in our reception room and I want to talk to you about a question that I get a lot. It's a topic that's probably near and dear to most of us as we're doing this Ask the Doctor video campaign. Invite you to give us any of your suggestions or any questions that you have that you may want us to address in the reception room video. So today I want to talk to you about osteoarthritis, aka arthritis, aka degeneration, aka degenerative arthritis, aka degenerative joint disease, aka degenerative disc disease, aka subluxation degeneration. There's a whole host of names for this. I don't like the term disease, degenerative disc disease, or shortened to DDD, degenerative joint disease, shortened to DJD. I don't like that term because this is not really a disease. It's a dis-ease, if you look at it that way, but it's not a pathology in the sense that we think of with pathology. So when I was younger, when I first started practicing, I probably looked young, I guess, which good for me. But I remember having conversations with patients about arthritis, and I would tell them that arthritis is not actually an old age problem or a wear and tear problem. And I could just tell that people didn't really believe me. I was fresh out of school and I knew everything there was to know about everything arthritis because I just came out of school. And so that was in 98. I know, I don't look that old, but that was in 98, X number of years ago. And at the time, we undeniably had proven that osteoarthritis was not an old age wear and tear problem, and that's what I want to talk to you about. Nonetheless, the scowls that I got from people forced me to say to myself, fine, you don't have to believe me. I'll go back into the research and I'll footnote all my information and I'll put it in a piece of paper and give it to you, and then you don't have to believe me, you can take other people's words for it. And I created a document that's in our treatment rooms, looks like this, if you can zoom in on that one. Right, so I created a bit of a handout to help people understand. I've had it forever, and I guess I've kind of gotten in the habit, or out of the habit, of showing it to people. But if you want more information on this, something in writing, you want to take it home, you're welcome to it. Just ask us for it. So before I go much further, the term arthritis is very vague, and it probably isn't a great way to describe things. In medical lingo, the ending of a word where it says itis, I-T-I-S, means inflammation of whatever the root word is. So if we say arthritis, it means inflammation of arthro, which is joints. If I say tendonitis, it means inflammation of tendon. If I say bronchitis, it's inflammation of bronchioles. You get it, right? So arthritis technically means inflammation of a joint. Well, if I kick you in the knee and your knee swells up, you have arthritis, right? So a lot of us suffer arthritis to some degree in any given year, no matter how old we are. But when the term arthritis in general pertains to a degenerative condition, an inflammatory condition, usually associated with swelling, pain, sometimes redness, stiffness for sure. So I get that question a lot. A person will come in with a sore, inflamed joint and they'll say, do you think it's arthritis? And I'll have to say, well, yeah, technically it is arthritis because the joint's inflamed, but that doesn't mean that you're suffering from the ailment, that which we know of as arthritis. The second thing I want you to know is that term arthritis is very vague, and it tends to cover a lot of things in sort of lay people's terms. So you need to know that there's really two categories of arthritis. There's an inflammatory arthritis, and there's degenerative arthritis. So let's talk about the inflammatory arthritis for a second. That includes things like rheumatoid arthritis and all of its cousins. And there really is a number of cousins of rheumatoid or inflammatory arthritises. Psoriatic arthritis, enteropathic arthritis, a whole bunch of other ones. We're not going to talk about that today. Those type of arthritises are diagnosed by blood tests. The way that they present is somewhat different than degenerative arthritis. Inflammatory arthritises tend to affect both sides of the body at the same time. For example, both knees or both wrists, both shoulders, both fingers. And as I said, they're diagnosed with blood tests. Osteoarthritis, as I started this video, otherwise known as degenerative arthritis, degenerative joint disease, degenerative disc disease, et cetera, et cetera, et cetera. Those types of that type of arthritis is diagnosed by an X-ray. You can predict with pretty accurate certainty whether or not a person is likely to have some form of degenerative arthritis based on some of their presentations, but technically it can only be diagnosed by X-ray. Okay, so that's the one that I want to talk about. That's the one that probably will affect all of us at some point in time. It's by far the most common, and it also is the most preventable. It's also the most misunderstood. So I would say that 80% of the people in our practice here we're dealing with some form of arthritis. So the reason for which they presented to this office was because of some sort of connection with osteoarthritis or degenerative arthritis. Okay? That said, this has nothing to do with getting older. And as you know, I take X-rays of a lot of folks, and part of the report of findings that we do when we start out with somebody new is we show them their X-rays and explain to them what's going on. So 80% of the time or more, I'm explaining to people that they have some form of osteoarthritis. And I always hesitate when I tell them that, because I know that instills a little bit of panic with people. People get a little bit afraid of that because we all have visions in our head of people that we've known who are riddled up with different types of arthritis. I'm here to tell you that that type of arthritis is usually rheumatoid type arthritis, not the osteoarthritis, okay? So when I explain that to people, of course I have to explain after the fact what it actually means, and in a sense I'm trying to downplay it a little bit. I kind of feel bad about that because I don't mean to downplay a problem that's given you trouble, but I'm trying to put things in perspective. So I thought that we'd do this video to try to help things out a little bit. So we've already covered a fair amount of sort of myths that surround arthritis. So hopefully now you're pretty clear that there's two types of arthritis. There's rheumatoid arthritis, there's osteoarthritis, which goes by a whole lot of aliases. Degenerative arthritis, degeneration, that's usually what we'll describe it as in this office. It's something that has nothing to do with your age. It's not a wear and tear problem, although I know most of us were raised to believe that arthritis was an old age wear and tear problem. Not true. It's a complete fallacy. It's absolutely not true. I'm here to tell you that, and if you don't believe me, you can look it up. Having said that, I know that there's still a lot of healthcare practitioners that are telling people that it has to do with old, or that it's normal to get arthritis as you age. And I'm going to say that that's not true either. There's a big difference between normal and common. It's common to see more arthritis in people as we age, yes, but it's not normal. I have lots of examples of people who are into their 70s even, who don't have any significant signs of arthritis in their spine. I've also got X-rays of people as young as 12 who most definitely have evidence of degenerative X-rays in their spine. So it has nothing to do with age. So let's dive into that a little bit more so we can kind of explain it to you. Joints are made up of cartilage. So arthritis or degenerative arthritis pertains to the act of cartilage hardening, which basically means it turns into bone. So what you need to know is that every single bone in your body at one point in time was actually cartilage. So bone doesn't exist unless there's cartilage. So if you can kind of picture a microscopic matrix of fibers and cells and whatnot, cartilage provides that matrix. What makes cartilage bone, as you probably already know, is the deposition of calcium. We all know that bones are made up of calcium, and that gives the bone its rigidity and its strength. But calcium molecules need something to embed themselves into, and that is cartilage. So every single bone in your body at one point in your life, even if you're pre-birth, was basically cartilage. That's why children, when they're young, their skeleton is still largely made up of cartilage, and when a child breaks a bone, it doesn't snap like it would in an adult. It tends to bend and break. We call that a green stick fracture as if you were to take a living limb of a tree about that big and bent it. It wouldn't snap like a dried twig. It would bend and maybe splinter. Those are green stick fractures that we see in young people because their bones are somewhat softer and they're not rigid and hard, so they don't crack and fracture like they do in us older people. Okay, so when a joint space starts to degenerate on an x-ray, and I think we're going to do another video here because I'm probably going to go too long, and we'll show you some x-rays of what that looks like on an x-ray, but the joint space, you can't see cartilage on an x-ray. You can see bones, but you can't see cartilage. So in the spine, for example, or the knee is another good example, you'll see the end of one bone and the beginning of another, but there'll be a big space in between, and that space is mostly taken up with pieces of cartilage. In the spine x-rays that we'll see, you'll see that the joint spaces start to get closer together, and the ends of those cartilage spaces start to get rough. You'll start to see spurs, which we call bone spurs, because what's happening as the need for that cartilage to be used has been lost, the body says, well, I guess you don't need that anymore, and it starts throwing calcium molecules into that cartilage matrix, and it starts to build up a whole bunch of calcium, and essentially it starts to turn into bone. The problem with that process is, unlike the formation of bone where that deposition of calcium is very organized, and you end up with a really nice sharp looking margin of bone, right? It begins and ends at a sharp margin. When you have arthritic changes, it's kind of rough and ugly, so you start to see these jagged edges and whatnot. We'll show you some examples of that in a second. So the big reason for that is it's a use it or lose it phenomenon. So the law of use it or lose it exists throughout the entire body. If you're not using it, it tends to degenerate. So I've got some pictures that I want to show you here. I'll show you this here, if you can zoom in on this. This is a cross-section of a knee, okay? So there's a good example of how one bone ends, another one begins. There's space in between. The blue represents cartilage, and there's, of course, a little bit of gap there, all right? Inside that space, it's encapsulated. You can see this picture here. That capsule is made up of ligament. So ligaments are tissues that connect bone to bone. Tendons are tissues that connect muscle to bone, in case you're wondering. So this is all ligament. So a ligamentous capsule will encapsulate most joints in our body, certainly our knees. And inside that capsule is a fluid. The fluid is really important. That fluid takes away friction and allows things to be really slippery. Last time I checked, there's no man-made, I don't think there's anywhere in nature where the viscosity is as less as it is in a joint. So Mother Nature has provided a wonderful lubricant inside these joints where there's hardly any friction at all because of the fluid in the cartilage matrix, which is pretty outstanding. If you were to take a needle and suck out some of that fluid, you'd see that there's no blood in there. And that's because there is no blood inside of a joint, which is a problem, right? Because we know that there's living cells inside the joint, and we know that living cells rely on blood flow for oxygen and carbon dioxide, nutrients, and to get rid of wastes. So how is it that blood or nutrients and whatnot can get inside of a joint? Well, if you look at this picture over here, it shows you a sketch of the vasculature around the knee. And I have another picture over here on our fancy thing here. So some of you may have seen this. Okay, so I'm going to zoom in on the skeleton here. Okay, so you can kind of see there's the blood flow. This is the arterial blood flow of the knee. And if you look closely, there is no blood flow inside the knee, but there's a whole lot of branches of blood flow around the knee. And that's because there is no blood flow in the knee. But what does happen is nutrient and gas exchanges happen on the periphery of the joint, right? And so the outside part of the fluid inside the joint receive nutrients and get rid of nutrients. The ability for those nutrients to get throughout the rest of the joint depends on joint motion. Here's an example. This is a glass of tea. It's dark, right? If I was to set some milk in this tea, it just sinks to the bottom. It does nothing. Can you see that okay? It does nothing. if I take a stir stick and stir it up, oh, look at that. It distributes the milk, the fluid, whatever, the substance throughout the rest of the vessel. That's exactly what happens in joints. So if you don't have joint motion, you will not get good nutrient flow inside the joint. And if you don't get good nutrient flow, then cells start to die. And when cells start to die in cartilage, that's the beginning of a degenerative process. As that cartilage starts to get less used, the body kicks off this ancient mechanism that decides, guess you don't need me anymore. So it starts to drop calcium into that joint cartilage matrix to bolster it, keep it stronger, which in the short term is helpful, but in the long term, not so good, because the function of that joint starts to fail. And we'll continue this discussion on our next video.